Bonjour et bienvenue à cette conférence de presse concernant la campagne de vaccination contre la COVID-19 au Québec. Mon nom est Marjorie Côté-Boileau, attachée de presse du ministre Christian Dubé. Alors, le ministre de la Santé et des Services sociaux, M. Christian Dubé, est aujourd'hui accompagné du directeur national de santé publique, le Dr Horacio Arruda, ainsi que du directeur de la campagne de vaccination contre la COVID-19 au Québec, M. Daniel Paré. Alors, sans plus tarder, M. Dubé.
Merci beaucoup, Marjorie, et bonjour à tous. Bonjour à mes collègues, Dr Arruda et M. Paré. Alors, peut-être avant de faire le point sur la situation épidémiologique, je veux dire quelques mots sur le contexte dans lequel on se retrouve. D'abord, premièrement, le Québec est frappé par une quatrième vague et je dirais que pour le moment, on s'en sort beaucoup mieux qu'ailleurs, notamment en Amérique du Nord et lorsqu'on compare à l'Europe jusqu'à maintenant. On est une des nations les plus vaccinées de la planète et pour ça, on remerciera jamais assez les Québécois des efforts qui ont été faits dans la dernière année. On a été le premier
The interpreter apologizes. We are experiencing a technical glitch. We'll get back to you as soon as possible. Once again, apologies from the interpreter. We are experiencing a technical difficulty. We are fixing it as we speak.
On va aussi implanter la vaccination obligatoire dans le milieu de la santé. La santé publique, l'équipe de Dr Arruda, devrait nous faire sa recommandation cette semaine suite à la commission parlementaire qui s'est tenue la semaine dernière. Là encore, on va regarder comment ça se passe et on va ajuster notre tir au fur et à mesure. Ensuite, on pourrait envisager d'élargir la vaccination obligatoire, mais on vous reviendra là-dessus en temps et lieu. Les principes, en fait, qui nous guident sont toujours les mêmes. On veut réduire au maximum les hospitalisations parce qu'on veut protéger notre réseau de santé et éviter le plus possible les contraintes sanitaires pour les personnes qui sont doublement vaccinées. Bon, maintenant, quelques mots sur la situation épidémiologique actuelle. Le niveau des cas, je dirais qu'il est relativement stable et c'est encourageant. Je dis ça parce que vous avez vu, je prendrai juste une petite seconde pour vous donner quelques chiffres. La semaine passée, on roulait à peu près à 600 cas par jour. Vous avez vu que les 2 derniers jours, on a baissé, mais soyons prudents, c'est des cas de fin de semaine. Moi, je regarde les chiffres, là, puis je peux vous dire qu'on va revenir à 600 assez rapidement. Là.
600 pretty quickly once we lose the weekend effect. So we have to, I would still state that it is relatively stable because we're still in the 600 cases that we've had for a few weeks, and it's not exponential, as very often Dr. Arruda tells us. So if we go with the YINES predictions, which will come out on Thursday as usual, and which we had a first version last week, or yesterday, we will have a pause in hospitalizations and cases over the next few weeks, and I would say particularly in Montreal, an increase in the case in Montreal if the trend continues. And as I said last week, for us what is important is that we must keep an eye on the month of September. Remember I said it really is a critical month. We have to keep an eye on it, particularly because of the back to work, back to school. It's obvious that the number of cases is going to come up, so we can't be surprised about that. But what we wish to do, and I repeat it, is to limit hospitalizations for the time being. And I've been asked that question, and we'll try to be even more specific and transparent. But for the time being, I would say, despite the increase in cases, the hospitalizations have remained at a level that is relatively low, and I like to be careful when I say that because, the healthcare staff still finds it too high. So I say it with a lot of reservations. But what Dr. O'Patterney was saying, and she was repeating those numbers to me this morning, we're at about 15 to 20% of our real capacity, depending on the regions. That is to say that Montreal is at about 25%, and in certain regions it's at 15%. So that's the good news, except that it can change very quickly. So we do have leeway that comes to us with vaccination. But I repeat, when we have days when we have 20 cases that have to be hospitalized, well, of course, the situation can change very quickly. I would say, however, that we are also able to observe the same phenomenon that we saw during the third wave, and that is the young people catching the virus. And I want that to be heard clearly. It's young people catching the virus these days. And unfortunately for them, And I'm not trying to scare anybody. I'm trying to be as direct as possible. Young people are catching it, and they're staying at the hospital longer. And why is that? Because their symptoms are more serious, their immunity system reacts even more. Therefore, the symptoms that they show, the respiratory symptoms, are much stronger. So understand that when you are young and you feel strong, that's one thing. But when the virus hits, well, unfortunately, we have a lot of young people who are still not vaccinated. So you know what the recipe is. The last comment that I would like to make on this situation is to remind people that even if you have received 2 doses of the vaccine, the virus is still present, and we have to continue following the health guidelines. And I'd like to pause on that for a second. We're feeling a little bit untouchable the day that we get the second dose. You all realized, and for those who are here and those who are listening to us, it seems like once we got our second dose, we feel like, okay, we're fine. But listen, the virus is still around, and the virus, the vaccine, does not protect you 100%. We've seen it. There's all sorts of conditions. So I would like to remind people, if you have the least symptom, even if you have 2 doses, please go get tested. But in the meantime, protect yourself. Okay, so now, with the good news, when I said that we were the best in the world, as far as vaccination is concerned, I'd like to remind you of the numbers, because Dr. Arruda and myself talk about it very often. We have reached 86% of people with the first dose. I'm talking about the category of 12 and over. This morning, as you were able to see, we just reached 79% for the second dose. That means that within a few days, if things continue going well in this way, and that is why we're enticing people to get vaccinated, we might get 86 or 87% first dose and 80% of second dose, and that is before the month of September. So it's never too late to go get vaccinated, and we'd like to repeat it to you, it is the best way to protect yourself against this 4th wave. There's a statistic that Dr. O'Patterney mentioned to me over the past few days with Dr. Arruda's team. A person who is adequately vaccinated has 24 times less chances of being hospitalized than a person who is not. Please remember that when you have difficult decisions to make to go get vaccinated. A few words now on back to school. I said that we'd be very careful with the back-to-school period over the next few weeks, and we will take advantage, and Danielle will be able to answer all your questions on that. We're going to take advantage of the back-to-school period to make a vaccination effort, an even greater one in our schools, and most particularly in primary schools, because people don't yet have access to the vaccine. So we have agreements that are going to be made with school boards, and I'd like to give you a statistic that I believe to be important. And now I'm speaking most particularly to the parents of children who are in primary school. The vaccination rate that we have for the 12 to 17 category is pretty extraordinary. It is now for first dose at 80%. And that is before back to school. That means that we are going to amply be over 80% for the first dose. However, and you won't be surprised, public health has identified that there are lower rates despite that 80%, which is an average. We have lower rates in certain neighborhoods in Montreal and in Laval. As an example, Montreal and Laval is at about 70, 75, 77%, so it's a lot less than the average. The good news, and I wish to congratulate the people from the National Capital Region and the Saguenay region, they are at 87%. So it gives you an idea of the catch-up that we have to do in our regions, and that is why we've asked, while we're doing the vaccination, to really insist upon these things. And parents who are not vaccinated during these processes could do so as well with their children. And once again, thanks to the collaboration of public health, we are going to be developing a very quick short-term action over the next few days of rapid testing in about 100 schools, and that follows the work that had been done by Dr. Quash in the spring. So, primary schools, in the more troublesome zones of Montreal and Laval, and then eventually in primary and high schools, we will be applying that policy of rapid testing that is complementary to the PCR tests. Now, I know that everybody wants to hear about the vaccination passport. It's tomorrow. I'd like to remind you that it is tomorrow, I confirm it, and that you will have to show your QR code when you go to places and activities that we've already talked about. I'd like to remind you that the list of places had not changed. It's bars, restaurants, gyms, and activities that we call at that have a high volume, like shows and cinemas. We're ready for tomorrow. I'd like to say to business owners that I thank them ahead of time because we know that the following 2 weeks are going to be, as we sometimes say, a little bit rock and roll. I want to be quite transparent. For some people, it's relatively easy. For others, it's a little bit more complicated. And that's why I repeat that we gave until the 15th of September before we start applying the penalties. However, there is one thing that I would like to say. We will not be applying the penalties, but we will be asking business owners to require the vaccination passport to be sure that people who go in are those who do have a vaccination passport. Now, those who don't yet have the Google or Apple app, particularly for Google, that came in yesterday late, I'd like to tell people you can always bring your QR code in paper mode. If you weren't able to put it in the app, that's all right, because it's not so much the app that is important, it's having the QR code. So you can have it printed on paper. I'm thinking about the elderly people. Ask people that you know who can come and print their code for you, or by taking a picture on your Android phone or your iPhone. So I'd like to tell you what is important is that when we go to the restaurant and things like that, you must have your QR code, and it is even more easy if you have the app, because the app facilitates the interface with business owners. It'll make their work a great deal easier. Now, I would like to say that the VaxiCode app allows you to have that access. And I would like to say, I really appreciate, once again, the work, because over the next few weeks, it's going to perhaps be a little bit more difficult, but we have gotten used to worse. We got through it, and I think that business owners are telling us that, we might not like that, but we do prefer remaining open. So I would say that it is the compromise that we had to find. And I'd like to remind you of one thing to end with on the vaccination passport. It is that not only you have to present your QR code, because sometimes, people forget. I suggest to you to have at least either your driver's license or your health card, because it will allow to show the picture easily. So business owners will have to tell you, okay, you have your vaccination passport. Well, now you have to show me your driver's license to make sure that it is the correct Daniel Paré or the correct Dr. Arruda. Now, we've had comments. A point that I'd like to add for the 75 and over, we know that we have a lot of people who are in full health at 75 and who look forward to going to the restaurant. Unfortunately, those people very often don't have their picture on their health card. So what we'll do for those people is the card that they present, as long as it has their address on the card, they don't need to have a picture, like we have on the health card. Because very often those people don't necessarily have a driver's license either. So that is the lightened load that we're allowing to have the ability to be flexible so that those people can go out with peace of mind. And to end with, a reminder that respecting health guidelines for me remains essential. Dr. Arruda says it very often, and we can't forget it, because even if you have received 2 doses, you have to continue following the health guidelines. I'd like to say also to those people who have had 2 doses of the vaccine, sometimes you don't feel very ill, but you can be a bit tired. I think that we really should not hesitate in getting tested. I've said it, and I like to repeat it. It's important. We saw a decrease in the testing over the past few days. I hope that it is just a situation for the weekend. I will see over the next few days, but I go get tested. And I would like to repeat, it is a combination of vaccination and the health guidelines that will allow us to limit the spread. If we compare the situation that we have in our hospitals right now to that of last year at the same time, it's very encouraging. I'd like to repeat that. We have to take the good news where we have them. Up until now, things are going well. And despite the fact that cases are higher, hospitalizations, as I was saying, are stable. However, we can never think that we've reached victory. Dr. Arruda reminds us that every day. So I would like to repeat, with the back-to-school period, September will be very determinant. And I'd like to repeat it again. Thank you to all Quebecers for the efforts that you are making. English.
Quebec is one of the most vaccinated nations on the planet. We were the first one in Canada to put in place a vaccination passport. We will see how it goes, and we will adjust before considering expanding it. We're also going to implement mandatory vaccination in the health sector. Santé Publique and Dr. Arruda's team should make this recommendation to us this week. Again, we'll watch how it goes, and we will adjust as we go. Then we can consider whether or not to extend mandatory vaccination. Now, on the epidemiological situation of the last days, the level of COVID cases is relatively stable, and this is encouraging. As I said last week, it is the month of September that we are going to monitor very closely with the return to work and school. We can indeed expect to see cases rise. What we want above all is to limit hospitalization. I would also like to remind you that if we are doubly vaccinated, the virus remains present, and we must continue to follow health measures so as not to be part of the spread. We will be vigilant with the return to schools in the coming week. We will take advantage of the return to class to make vaccination efforts in school. We have agreement with all school service centers. Our first dose, which is the good news, first dose rate are generally very good for the 12-17 category and are at 80% on average. But we have lower rate in certain neighborhoods in Montreal, which is at 70%, and Laval at 77%. And then, to help us control the spread of the virus in school, while we continue to vaccinate, we will deploy also rapid tests. First, in the elementary school in the red light district of Montreal and Laval, and gradually in all primary school, then secondary, as recommended by public health. Few words on the passport. On the vaccine passport, I remind you that it will be in effect tomorrow, and you will have to show your QR code when going to the places and activities concerned. For those who do not have yet the Google or Apple application, you can bring your QR code either on a piece of paper or by taking a photo or a screenshot of your QR code and put it on your phone. The obligation as of tomorrow is to present your QR code with an ID, with a photo, such as the driver's license or the health insurance card. Important for those people that are 75 and above, it will be necessary to provide necessary identification, but their ID doesn't need to have a photo. And in conclusion, I would like to remind you that the respect of health measures remains essential even if you are doubly vaccinated. It's the combination of vaccination and health measure that will allow us to limit the spread of the virus. With the return to school, the month of September will be very decisive. Thank you very much, and we'll go for questions.
Oui, alors nous allons maintenant procéder à la période de questions des journalistes. Donc,
We are now going to start with the question period. One question and one follow-up. Hello, everyone. My first question is for Mr. Dubé. You mentioned that the vaccination passport, there already were discussions to perhaps extend it to other places. What are you talking about? What are you thinking of? We've had a lot of questions on the part of employers. We know it because people, we are worried with the back to school, but I think that employers are also worried about back to work. And we've been very clear. We said, let's go step by step. We'll see how things work with the sites that we've called non-essential, although in my case I find that, certain ones are essential, but we have to be able to do it gradually. Of course, there are employers who do it, I would say, on a lightened basis or who talk about it, but for now, for the time being, we have no further intention, and that is what I wanted to clear up today. However, We've been having a lot of questions. Public health has received a lot of requests to do so. We just had to get ourselves ready to see how it will be done, but for the time being, we don't intend to. As far as the vaccination is concerned, the latest INES report, that of last Thursday, the last one that was made public for us, talked about an increase of cases, and the most significant one was in the groups of people from 0 to 11 years of age, an increase of 56%, but that age group cannot be vaccinated. Concerning that statistic, are you thinking of reviewing the health guidelines for primary schools? The health guidelines for primary schools have been reviewed. We added wearing the mask as such. You'll understand that the good news is that young people, even if they get it, very often don't have complications. That's a good news. It would be very different if they were at risk, if they were vulnerable. So we expect, and we are waiting for a vaccine to be able to vaccinate the 5 to 12 years old. But we are expecting for cases, but not to have any impact on the hospitals. But to avoid spreads or outbreaks, we will have a very prudent approach where there are a lot of circulation. That is why there are 9 regions in Quebec where there is the use of masks that is going to reduce exposure, but also and we will add, rapid testing to be able to keep children in school as long as possible while excluding those who are cases. And maybe Horacio, if you'll allow me, just to perhaps give a minute to Danielle to talk about the vaccination effort that we're going to be deploying. I think that it is important to reassure parents that there's a lot of effort being made. Yes, there are fewer children who are vaccinated, but we said that we're going to be doing it in 2 steps, if you'll recall. So what will be done and what are the protective measures? I think that Mr. Dubé was mentioning it in his in the numbers. 80% of our young people from 12 to 17 are vaccinated, but we want to give the opportunity to people to choose vaccination, those who haven't yet. And the CIS and CIUS, together with the school boards, are doing a lot of collaborative work. There's vaccination being done, arrangements for transportation, so that schools in Quebec have that service. The good news is that those who had already had a first dose, 80% of that group has already received a second dose. We wanted to get to, it's at 80, we'd like for it to get to 81, 82, and we know that with back to school, it's a good means of catching up to them at that level. And for parents as well, parents who chooses vaccination, even if, we'll be able to vaccinate as well. And I was talking about, vaccination as well. Perhaps Dr. Arruda could update us about where we are while we are waiting that the vaccination for the group age of 5 to 11 be approved by Health Canada. It was supposed to be done in September. Now it looks like it might go to October. But at any rate, together with Mr. Paré's team and the CIS, we are preparing ourselves for vaccination. So the day that the vaccine gets approved and we have it in our fridges, well, the vaccination will start for that population. So we're thinking that perhaps in November and December we'll be able to vaccinate those 5 and over, 5 to 11. And if the product is approved for those even younger in January 2022, we'll continue according, depending on the recommendations and the use of the product.
Oui, bonjour, Jacques Bissonnet, Radio-Canada. À propos
About the vaccination passport, there are associations of bar owners who wish at the end of 2 weeks, once we'll have checked passports and that everybody will have 2 doses, that at the end of 2 weeks there's a lightening of measures. For example, that bar rooms be able to be full, that we be able to reach a higher number of people so that they can make profit because they've suffered a lot from it. Is there that possibility at the end of 2 weeks? When we did the pilot project, we were asked that question quite a bit, and perhaps I've talked about it already. I'm sorry if I'm repeating myself, but the agreement that we have, and I'd like to repeat it to those starting tomorrow, is that let's start and see how the following weeks are. I think that it would be very risky to bring lightning at the same time as we allow people in the middle of a 4th wave and we see the cases increasing to on top lightening things up. We talked about it a lot with Dr. Arruda's team. Let's keep things this way. But I remember when I went to Quebec and I saw pilot projects, people asked us, and we said, listen, we're taking it into account, but we have to get through these first few weeks. We have to be able to look at what's going on. We're not closing the door, but I would prefer to see that things are going well before bringing any lightening to the measures. There are hackers who went into the system. It would seem that there is a group of hackers who wanted to do it in a positive way to help you. Your colleague, Minister Kerr, last week was even saying that people who played in that field could expose themselves to problems with the justice. Would there be a kind of immunity for people who wanted to help you by hacking the QR code? That's a good question, because my colleague Eric a few minutes ago put on the social media, you can go have a look at it, but taking into account, I'll say it very humbly, that we've had a certain leadership in the vaccination passport. We know that, we did build the plane while flying it. And Dubé, with his cybersecurity team, clearly said this morning on social media that he was ready to collaborate with whom I call the well-intentioned hackers. I had to be careful with my word, because there are people who approach us and they said, because of the work that we do, we'd like to be able to help you. And I'm saying we are very open to that. But when it's, a hacker with bad intention, that's when things change. So I would like to stay with that, because we've put Mr. Kerr's team on that. They will follow how things happen. And for the app, I would like to reassure people, we have put a group of internal and external experts on that who are helping us out, because we can see that it is very popular, and we want to make sure that the data remain protected. So yes, there will be collaboration done with those who wish to help us. We're ready to take all comments, because what we want to do is to improve the system. The only thing that I would say is that when we set this up and in the structure, the way that our IT people designed it, it had to be simple. It had to be simple because we know that we have elderly people whom we wanted to allow to be able to their QR cards easily. So we had that balance to keep. But I think that with the collaboration that Mr. Kerr's team will have with these well-intentioned and beneficent hackers, I think that we'll be able to collaborate and continue. About the vaccination passport, after the 2-week period where we'll be tweaking things, how will it work? The fines, will it be inspectors and things like that? Well, I hope that there will be as few as possible. We had said that it was the principle. Of course, if there's no fine, some people might take advantage of it. Well, I would like to remind you that the fines, whether it be for business owners or Quebecers, it can vary from $1,000 to $6,000. It's pretty significant, and I think that it should make people think. But it's the same principle as wearing the mask. Remember, last summer, when we decided that the mask would become mandatory, was the same kind of principle. We said it's annoying for commercial and business owners, but please make sure that people wear the mask inside. I would say that it's the same thing. And there are cases where it might be the business owner who won't want to do it. That's a little bit more of a delicate situation, because if business owners do not want to do it, well, listen, they will have the choice of keeping the restaurant or bar or gym open. because we're doing that so that businesses can remain open. And that has to be clearly understood, that public health does still have the right to say, if you do not respect the rules and the health guideline, the vaccination passport is one of those rules. So I would say that it's even more dangerous to have your business closed if you don't want to respect it. So it's police officers who are going to do it. The first person responsible for it is the business owner. We give them the flexibility of asking, that they'll have to find the best way, whether at the door or whatever, but they're the ones who have to make sure that their clients are adequately vaccinated. Now, if they need help, somebody who will, who wouldn't want to, as we did for the mask, we put public officers, there. For the rapid testing, could we have more details of who is going to be affecting those tests? Who are those people who are going to be chosen? It will be staff in schools that is going to get training. They'll be able to administer the tests. And the young people who are targeted for that are young people who have symptoms. Once again, I think that Mr. Dubé had said it earlier on, if there are symptoms at home, go towards a screening center before going to school. Even if sometimes it's whatever, just a runny nose or whatever, it's those young people. And also, tests that will help my colleagues from public health with Horacio in their evaluation work and all that. So the purpose is that children stay in school. The purpose is that we go back to school as normally as possible, that we try to maintain our way of life, etc. And these are tools that are available and that can help us with a specific purpose of prevention. It does not replace the super specialized tests, but these are good tools that can really help us make a difference. One clarification on that, because what happened following the pilot project of Dr. Quash that was made in 2 schools in the spring, there was also set up, so we're very appreciative of public health, of no longer having the obligation that rapid test be done on the staff. So that gives us a lot of flexibility to do it, for example, with other kinds of staff. And the staff is now set up. So all of that is happening well. And I'd like to repeat, about 50 schools where we are going to have schools in 4 regions that were suggested to us by public health, and the rest are going to follow. Hello, all 3 of you. Mr. Dubé, about the mandatory vaccination for the employees of the health sector, what remains to be decided before you are able to announce to us something official? What has been complicated in the end, and have you decided what the consequences will be imposed to those who are not vaccinated? I will let my neighbor to the right. He is the one from whom we're waiting for the final recommendation. Well, the devil is in the details, in how things are applied, how we identify those people, 50 minutes or not. And you saw, I heard the commission, I even heard it, certain videos more than once, to take into account the input from all the stakeholders. And there's no unanimity, as you know. But it is within those elements. And now we know we are honing it and clearing up. And I would like to tell you as well, the context in which I'm making the decision today, what it means today, what it does not mean for tomorrow. If, for example, we vaccinated healthcare sectors, a kind of staff that we can find elsewhere, but they're not in a healthcare setting, well, that difference has to be justified. So we're in that. In fact, technically, for me, is that I cannot say, I'm not going to listen to the commission. I heard the commission, so I'm listening to them, and I'm going to see whether they don't come and modify those elements. So the devil is in the details, in the precision that we have to bring to everything. As far as the application of the vaccination passport is concerned, in certain areas there's a bit of confusion. I'll give you an example. In the hotels, they're wondering, is it our responsibility when we organize congresses, for example, with 200 people, 250 people in our establishment, who is supposed to check to make sure that people who are present at the Congress are adequately vaccinated, because, to go into the hotel room, there's no problem. You don't need a vaccination passport to go into the room where the Congress is. Is it the organizer of the Congress or is it the hotel staff? There's a bit of confusion about this. Well, listen, the physical place is really important. So once again, the room, depending on the activity that's there, first of all, that responsibility belongs to the owner. Of course, in a contractual agreement, I'll take your example, the Congress, well, that responsibility would be shared. But once again, the physical places, independently of the activity, the responsibility is that person where that takes place.
Bonjour, Alice Girard, c'est la presse. En regardant les chiffres, voyez-vous une corrélation?
Looking at the number, do you see a correlation between new cases and those areas that are where people are less vaccinated? Well, of course, we see, there is, I would say there is a certain correlation. It's not a perfect one between those neighborhoods where people are less vaccinated and cases. For sure, there is one. But any correlation is imperfect, and that is why we're trying to cross the different information sources as much as possible, but for sure in certain neighborhoods, and it is the reason why we're doing a blitz in schools following the recommendations of public health, of going in those 4 neighborhoods, because there is more spread going on, because there's less vaccination. If you'll allow me, what is quite clear, there is a great correlation between the unvaccinated and hospitalizations. The minister said 24 times more likely if you're not vaccinated. So without us necessarily being able to, because of the numbers, we usually are able to make a correlation, but statistically speaking, a less vaccinated sector is more at risk of having cases that will end up being cases of hospitalization. So there's an indirect correlation, that much is very clear. But we don't have the quantity of cases right now to be able to make that final element. And what is very important is that even if people say, but why do I have to go along with the health guidelines of masks and all that if I have been vaccinated, well, the vaccine is excessively useful. And bravo to Quebec, we're really decreasing the number of cases of hospitalizations as well. But we can still transmit the disease to others. That's why it's important to still protect yourselves. So if you have symptoms, get tested, even if you have been adequately vaccinated, and get vaccinated, because your risk, you might not even notice it. You might only feel like you have a bit of a cold, but take care of the others by doing so. Are you thinking of extra measures in those regions of Quebec that are more affected by the 4th wave? Well, I would say not for the time being, because I think that it is important for us to be able to follow the guidelines. And there's already a lot of them in place, and we understand that, well, the answer, as the minister said, is to increase vaccination. Yeah, that's what the answer is. It's to convince people who are hesitating for all sorts of reasons, That is what is going to protect them, and that is going to protect people collectively. And that is why the approach to go get that vaccination, and also to avoid transmission in those areas. But in terms of populational measures, I think that the answer, vaccination. Thank you. I don't know if you mentioned it in the past. What is the cost of the vaccination passport? 2 apps on 2 platforms had to be designed, and Mr. Trudeau announced a measure of $1 billion to help for the setup of a vaccination passport. I have the impression that $1 billion is huge, that it's incredible. What about in Quebec? Well, I'll start with the good news. The apps are free for users. Their development was paid for by the government. In the case of both apps, the one that we call the VaxiCode and the Vaxi RF. And throughout all that we've done, that amount is negligible if we compare it to the others. We were able to, thanks to great collaboration between people from the IT sector, the network, and external people. I'm thinking about Equinox Firm, for example, the equivalent of what we did when we did the work on appointment centers with Clic Santé. Once again, another Quebec company that came and helped us out. So these are not really significant costs, you know. We signed agreement with those people, so I can't talk about it, but it's really not that high compared to what it could have been. And that is why we continue collaborating with people externally, because we want to improve, as I said earlier on, we want to improve the app. I don't want to see that it's negligible, but these are not significant costs compared to the issue that we have. What's important, and I'd like to repeat it, is those who are going to be operating it. Those are the ones that are going to make a difference. It's really our business owners that we're giving this to and who will make a difference in being able to continue opening our restaurants and bars, gyms, and all that. A comment on Mr. Trudeau's measure, because it does seem to be excessive, but another question is when you talked about the INES report, there's going to be an increase of cases and hospitalizations. In a part of your mind, is there a scenario that wishes to strengthen the measures the week that happens? Or is the application of the vaccination passport, you know, the miracle solution? I'm going to start, and I'd like for Dr. Arruda to continue. As you know, we've had many conversations with the INESPQ, with Dr. Arruda and his team, with the INES. And I'd like to give an example. We're looking at a curve in the UK over the past few months with a vaccination rate that is very similar to the one that we've reached. We're even a little bit ahead of time compared to them. And what we saw, and that's the good news, is that the cases increased, but when we compare the third wave to the fourth wave, the hospitalizations are about 30 to 40% fewer than they were in the fourth wave for them. That is what we want, is to be able to have the effect of vaccination. It's not going to be perfect, and when we see it, we continue having hospitalizations. But if ever we had about the same thing that took place in the UK, it could give us quite a bit of help with the hospitalization. So I think that that is perhaps the best answer. Dr. Arruda, do you want to add anything? The solution is vaccination. That is what increases the rate of protection of the general public. We'll still have, you know, young children who are unvaccinated in the long term, in the short term, I mean. When we can vaccinate them, we'll have a better protected population with cases every once in a while, but not big outbreaks. The advantage that we have, and now you know the devil is in the details, is there going to be a new variant? Is the new variant going to respond to the vaccination? Are we going to have to give a third dose and all that? But I would say in the short term, everything that favors vaccination, that is what the solution is. The vaccination passport is one instrument, convincing people is another one, and that is how we'll protect ourselves first. And that will protect, you know, ourselves from complications and having to go to the hospital, too. And even if we can, if we still transmit, we do decrease the transmission a little bit. So the solution is vaccination. And in the meantime, if things start getting so exponential that our healthcare system, you know, is overwhelmed, we'll have to protect it because we have to be able to treat not only COVID, but cancers, heart attacks, and all that. We don't want to get to that. And as I've always said, what I'm saying today might change tomorrow, and people are going to blame me for it, but I cannot predict. I'm not Nostradamus. But people ask us sometimes, you know, of having objectives. And I would say today, first dose, we're at 86%. It really is very good. Tomorrow, within 2 days, we should get to 87%. That means that we continue, and that is the message that I want to give today to all Quebecers listening to us. Even if you find that it's late in the process, it's never too late, because you can still have your first dose this week. Daniel's team is ready to vaccinate, and I would like for next week to ask for people to say 87, 88%. A niche percentage point, I'd like to repeat it to you, is 75,000 people. So we can do that in one day, vaccinating 75,000 people. We vaccinated about 5,000 or 6,000 first doses today as we speak, but we could do 4 times more people, and maybe get to 90% of people with the first dose by the end of September.
Merci pour votre
But that is in the hands of Quebecers. So thank you for your question. Vaccination can make the entire difference over the coming weeks.
Oui, bonjour, Olivier Fauché du Journal de Montréal. Une question pour
A question for Misters Dubé and Arruda. What percentage of vaccinated people, what percentage do we have to reach for a vaccination passport to no longer be used? Or what other criteria might be used? People like to have a number or an objective, and I'd love to tell you, but what I'll tell you, in fact, is that we had agreed that the vaccination passport will potentially going to be a temporary measure. When we make the demonstration that with a vaccination passport we control outbreaks in certain regions and all that, and we've always said that depending on the epidemiological situation, we might use it elsewhere. If we have outbreaks in certain areas, rather than closing them down, we may introduce vaccination passport. We call it, a posteriori vaccination passport. Now we're doing something in prevention, where people are at high risk. So I would tell you that it will depend on the epidemiological situation of where we're at in the vaccination coverage. Of course, we're going to need a high vaccination coverage, but don't forget that we have children who are not vaccinated, so there is a good proportion of the population, So we have to understand that it's all of the factors. There's not just one ever. It's vaccination coverage, what's going on in the different areas, is our healthcare system holding up, and our biggest wish is to come back as much as possible towards a sort of normalcy. But once again, we have to be patient, even if it's only because of the fact that we will be able to vaccinate people 5 years old and over as of January only. Dr. Arruda, when can we see lightening of the measures in those places that apply the vaccination passport? For example, when could restaurants have more clients who have 2 doses? Perhaps I wasn't clear enough, but I answered that question earlier on. We've agreed with many people with whom we've done the tests, and I'd like to repeat it to business owners. We're going to start by applying the passport with the measures as they are right now. If it's possible to lighten it up following the evolution of things, we'll do it as quickly as possible, because what we wish is for them to be able to be open, to be profitable, but we have to understand that at the beginning we have to keep those measures in place. English questions now?
Donc, on va pouvoir débuter avec le micro 1, question sous question, s'il vous plaît.
Hi, Caitlin Thomas, Montreal Gazette. My first question is if universities and CEGEPs have been instructed by the government not to require the vaccine passport, or if they could implement it if they wanted to.
You want to go with
in fact, there is some activities where they will use it, where there is some sports with contacts, and I would say not what is mandatory to education, but what could be else. That's the case. But they actually, as comparing to other places, they will not use the vaccine passport as a mandatory thing to get access to education, because for Quebec, it's an essential thing that have access to. But one of good news is that the rates in vaccination in those populations are good. And it's why, and if even a CEGEP guys or a university person is not well vaccinated right now, there is still the time to get vaccination. The rates are good. Daniel and his team made good job, and they will continue to do that, I think, this fall.
We're still present. So there's no excuse to not getting a vaccine in CEGEP or university.
Okay, to be clear though, is it a directive they received from the government not to require the vaccine passport?
In fact, in principle, as we always told, for essential things like go to work, have to go to a store to get food, you need to go. It's not going to a cinema or something else. Going to school is an essential thing. So in those places, actually, we don't recommend the use of it. But what we can do is, Passeport Vaccinal is very good, but what is more important is the coverage of your population in vaccines, because as soon as people are 90% vaccinated in the place, the risk is going down, and you protect yourself and others.
Okay, and second question, we've heard from many Quebec women who are concerned about their names not matching on their documents, so their maiden names versus their married names. Some have said they've been able to get it changed at vaccination centers, but we've also been told that that's not allowed. Can you sort of clarify what is allowed, what can be done, and what you suggest for these women?
Well, actually, this is a policy or regulation has been passed in Quebec for a long, long time that women don't change their names. So we use their first name, and so we applicate exactly the same rules for the vaccination passport. So this is why we don't have to change, and we will accommodate people when they will use their passport. Because imagine if we change the last name, they will not match with their medical card anymore. So this is why we have to keep the same rule as the RAMQ card.
Thank you.
Merci. Prochain média.
Good afternoon, Jay Termal from CBC for a question from Mr. Dubé regarding the Lakeshore General Hospital.
Yeah.
There was an internal memo we've received that revealed that in the ER, several patients were potentially exposed to COVID-19 because of, I guess, a lax of measures. People weren't notably wearing their PPE. And I'm wondering if what you think of this, people going lax, workers going lax on this, and there's anything we can do to correct it.
Yeah. Well, it's always difficult to talk about the specific cases because I don't think anybody in this hospital, and I know them very well, I've been there a few times, nobody do this on purpose. But there was a case where an employee was not vaccinated, but we don't know what is the chain of event yet. Was that contaminated by a patient, or was the employee contaminating the patient? We don't know that yet. But I think it just shows. And this is the reason we had this recommendation by Dr. Arruda that people from the healthcare system should be vaccinated, not only for the patient, but for themselves. So I think this is unfortunately a case that serves as an example that our employees should be vaccinated.
That's vaccination, but there's also the fact that they weren't wearing the proper PPE, taking the proper measures.
And that's exactly why I'm saying that vaccination is one thing, but even sometimes we feel that we are very strong where we have received a double dose, and we still should continue to respect the measure. And that's the reason we're repeating it, not only to healthcare employees, but to all the population. We need to follow the measures right now because we are in a critical month because of those pulmonary sickness that are coming back in September. So we need to be prudent.
Merci. Ensuite, question?
That was my
Second question?
Oh, sorry, I misunderstood you. Yes, second question is about the whistleblowers. Following Jacques' question. So there's people willing to help you correct some of the faults, I suppose you could say, they found in the app. They're willing to come forward and help the government sort of fill those gaps to correct them. We understood the one was promised immunity, and then it turns out that it sounds like he's being investigated by the SQ. What sort of message does this send to whistleblowers, and are you not willing to, if you're not willing to protect them properly?
Okay. I'll be very clear. First, my colleague Eric Kerr at the Treasury Council has been very clear this morning on social network. We will work with what we call the, the positive hackers, means that the people that will contact us to say we could help you because we are on the network and we can. Mr. Kerr has been very clear that we want to work with them. So for those that contact us and say we would like to find a little bit like the, I wouldn't say the bounty system that they have in France, but you know what I mean. We want to work with them. But there have been also some other people that maybe didn't do it on that purpose of helping. This is the way we want a difference. So that's the reason we've asked Sécurité Publique with Geneviève Guilbeault to continue investigation on the case that we had in general. But for those that want to collaborate, there will not be a criminal follow-up.
Merci. Prochain média.
Good afternoon, Elizabeth Zogalis, Global News. Just going to read a question from a colleague. Multiple hospitals across the island of Montreal's emergency rooms are at overcapacity, in some cases as high as 164%. Staff say it's due to a shortage in employees. What is being done to solve this situation?
Yeah. Well, two things. I've said at the beginning that at the beginning of the summer, when we had to make the decision to allow our nurses and employees to go on holiday, that we could have some difficulties in meeting the needs. This is exactly what we see right now. Because the reason that those rates are so high, it's not because of the people coming in. The volume that we're getting in our emergency is very low right now. We're probably functioning at 60-70% of the usual volume. So it's not a problem of volume, it's a problem of staff that we don't have. And that's the reason we need to reduce the services. In majority, our employees will come back from holidays by September 15. So we just need to go through this tough period because that was a commitment that we made, that our employees, because of what they've done in the last year, they needed to have this break this summer. It's a bit unfortunate, and I think Quebecers, they're so grateful what the employees have done for us that I think we pay a little bit for the shutdown in the services that we have right now.
Okay, and as sort of a follow-up to what happened at the Lakeshore with a COVID outbreak, is there any chances there will be a standardized quick test, rapid testing in all emergency rooms?
Well, I think the first thing we need to deal, and I'll be very clear, is we need in all our hospital to make sure that we respect them, that employees respect the measures. And when I say employees, is in general terms. And I think there have been, like in the population, there have been maybe a relaxation of certain measures because this summer, we were doing well. And I think that sometimes people are tired of those measures. And with the fact that this virus is so violent that people say the minute you relax, then the fire got back on. So I think the measures, and this is the reason we have this recommendation on obligatory vaccination. So it's a combination of both.
Merci, c'est ce qui met fin au point de presse d'aujourd'hui.
This put an end to today's press conference. I thank you all for having been present, and thank you. Thank you, everyone. Go get vaccinated.